Back when I started on this issue 30 years ago, I used to always tell audiences that every single day I see people that are harmed by our health system. And now it's similar, except I'd say every single person that I see each day at Poudre Valley Hospital is harmed by our health system. So I'll give you 2 examples. So one woman who has a very serious neurologic issue, the only treatment center available is in Boulder, but her insurance won't cover it. So she is not going to get the treatment. I just talked to her husband today. She is not going to get the treatment. They're just going to give up. Her quality of life is horrible. It's just not going to change. The second one was a man who his wife has been trying to take care of him at home, but he's had strokes, etc. And the physical therapists at Poudre Valley Hospital say that he is a 2-person assist. So when you're in Poudre Valley Hospital, we won't allow 1 person to help him. It has to be 2 so nobody hurts their back. He lives at home with his wife. They're alone. For the past 2 months, she's been overwhelmed. Both of them are okay if he would go to a nursing home because he's okay with the idea of having the help and she's overwhelmed, but he has no insurance to cover it. Neither one of them is willing to pay that. That would take away all the money they had to give to the grandkids. So that's, and if I don't have the greatest memory, but if I named the other people I saw today, I'd be able to tell you reasons why they're also harmed.
In 1982, I was training to hopefully get a berth on the first Olympic team for women's marathon. I was training for a marathon, which I ran, but a week before I got the flu. Went ahead and ran the marathon anyway. Didn't get quite as fast of a time as I thought I would. But 2 weeks later, well, it went on for about 6 months. I couldn't walk up a flight of stairs. I got a disease called cardiomyopathy. Turns out it runs in my family, both sides. It took about 1.5 years to diagnose me because no doctors looked at my heart. I was a runner, active, in theory healthy. Got my first pacemaker in '84, and they told me I'd be dead in 2 years. And statistically, that was pretty correct at the time. 80% of the people are dead within 5. And it had taken 1.5 years to diagnose me. That changed my life. Healthcare ruled my life from 1984 until the Affordable Care Act passed. You're talking about staying employed to have health insurance. I had to be employed with an employer that offered group health insurance. It was life and death for me. If I were not married to somebody who had health insurance, I had to be working for a large employer. So for me, the Affordable Care Act passing for the first time in my adult life really afforded me the chance to actually ask myself, what would I, Jackie Marsh, a human being, like to do with my life? And I had gotten into making jewelry, and I decided to open Robust Designs on 4th Street. That was unimaginable to me for the last 30 years, that I could actually set my own course for life. And while I greatly appreciate that I can buy insurance, it is about $900 a month with a deductible of about $6,500, which I used all of last year when I had a knee replacement. I appreciate that I can buy it. When you have a pre-existing condition and they tell you no, 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 being able to buy it was life-changing, but I can't afford it. And as a small business owner, I have a full-time employee and some part-time employees. I try to pay a living wage, so it's between $15 and $17 an hour. One employee makes about $35,000, but she can't afford to buy it, and I can't afford to buy it for her.
My understanding of healthcare in France, I have a friend who lives in Paris, and while obviously it's not a perfect system, I know that there's a lot less steps to go through for people to just get healthcare coverage. They don't have to do anything. They can just go to the doctor and it's like taken care of. You know, there's definitely going to be some disadvantages to every system, but from what little I understand about how their system works versus our system, you know, it seems like very uncomplicated from a personal standpoint for, you know, her to just go to the doctor, and, you know, if she were to break both of her legs and need a wheelchair, they would just write her a prescription for a wheelchair and she would get to take a wheelchair home. You know, it wouldn't necessarily be this, oh, well, will your insurance cover a wheelchair, and how long do you have to wait for your wheelchair, and things like that. So I definitely think that a system that supports everybody in every situation, no matter what, is the best way for the world and everyone. Yeah.
My husband and I went on a trip to Italy and Germany. And when we were in Germany, we rode the trains, great way to meet people, and we were sitting next to two German women. One of them I found spoke English, so I asked her about the healthcare system in Germany and how it worked. These two women happened to work in the healthcare industry in Germany. It was what a coincidence. So I asked how it was paid for, and basically in Germany they pay for their health insurance through a payroll tax, like our federal and state taxes are taken out of our checks. But it's based on your income. It's a percentage of your income, which means it's based on the ability to pay. Everybody has the same percentage. So if you're making a small salary, your total dollars are going to be less, and that makes so much sense, rather than the way we do it in America, which is your health insurance premium is a flat rate, period. And whether you make a low 5-figure income or a high 6-figure income, your premium is going to be the same amount of money. And what fairness is there in that?
What we have today is literally morally bankrupt. The crushing medical bills, the prescription drug bills, even for people who have insurance. You don't think about that if you're living in another country. The idea that you might have to trade off the cost of medicine or seeing the doctor with food. The thought that you might actually go bankrupt because you can't pay your health care bills. It's a foreign thought. It doesn't even cross their mind that that's a possibility. Why would we allow that to be happening in our country? Those stories about the crushing costs are really important. People are reluctant to share those because they're embarrassed or they feel uncomfortable. But it's really important that the stories get shared. And it's not just those crushing medical bills. Think how our current financing system for healthcare undermines so many other things we value in our country. Everyone knows someone who says the only reason I'm still in this job is because of the healthcare benefits. It's not good for the person, it's not good for the company, and it's not good for society. Taking care of our elderly parents. The person who says, I'd love to cut back to part-time so I can really help with my elderly parents, but I can't, I'll lose my health care benefits. Same situation for the couple who says, one or both of us would like to cut back so we can have more at-home daycare, take care of our kids, instead of farming that out. Sorry, can't do that. If I cut back to part-time, I lose my health care benefits. And these are the things we say are important in our society, and then we put up a major roadblock to not allow it to happen.